Hello dear viewers, I have a lecture on my YouTube channel dedicated to the treatment and prevention of stroke. The lecture is the most ordinary for students, but it has garnered, just imagine, 250,000 views, as a result of which you have a lot of questions about the results of watching this lecture, and I am now attending them. I'll start with the most important ones. I've had 3 strokes, I'm young, I'm only 43 years. Why is this happening to me? Indeed, I watched her story. There were 3 strokes, and the first of them was at 27. A stroke in this case is only a syndrome and not a disease, but it is so because the disease is basically systemic, different in she may have vascular involvement, she may have thrombophilia, she may have rheumatic. The disease that is the basis for strokes is absolutely a certain one, not even related to neurology. What to do in this situation? First of all, it is necessary to check the folding system, to identify if there's thrombophilia, where blood can clot, in simpler terms, and this contributes to thrombosis. Basically, clots or blockage of blood vessels are one of the factors that lead to a stroke. The second point is everything okay with the cardiovascular system? Is there any irregular heart rhythm, or is there a heart defect? This is a very important factor for the development of a stroke. The third point, there's a question here. You mentioned in your lecture that young women are at risk of stroke because of the use of oral contraceptives. Yes, that's right. When a young woman uses pills, commonly referred to as birth control to prevent pregnancy, then her risk of stroke can increase because she suffers from, and might not be aware of, antiphospholipid syndrome. And this syndrome leads to the fact that blood clotting, in other words, the ability to form clots, increases many times. And here is an important point. If a young woman suddenly during a conversation, a gynecologist, not a neurologist, reported that she has had more than 3 miscarriages. Let's say if there were miscarriages more than 3 times, then this is a reason to get tested and go to a gynecologist, to a rheumatologist, to possibly an experienced therapist to rule out antiphospholipid syndrome. There are a whole range of tests that need to be done. And here a man writes, I have frequent migraines. Could this be a precursor to a stroke? Often I have a headache. Does it always hurt on the same side? Because with migraines, very often there is a so-called lability. Then it will hurt on the left, then the right side of the head will hurt, and this is normal. That's when there is a reason to be alarmed, what is called a bell to be alarmed. When the head always hurts on one side, all the symptoms, so-called auras, those who suffer from migraines, know these symptoms well. They are always one-sided. That is a reason to go to a neurologist, together with him having consulted to decide on examining the blood vessels of the brain and neck. Because sometimes in a person who suffers, on one hand there's always the head problem. It's caused by an angiovenous malformation, which is a change in a vessel that can eventually cause the vessel to rupture in a weak spot and result in bleeding. Now, let's move on to the next question. Doctor, what can be done at home in case of an ischemic stroke? Call 911 right away, or take your relative who's showing the first signs of a stroke to the hospital immediately. By the way, we're talking about this in the lecture. We explain in detail how to recognize a stroke at home. Take your relative who might be having a stroke and quickly send or go with them to a specialized neurology center. Do not wait in any case. You could lose your loved one. So the first recommendation is to not wait, but to go to the hospital, not the clinic. Incidentally, I'm also on other social media platforms where you can watch my reels, where I analyze clinical cases specifically for patients, not for doctors, and you can learn from them. It's better to learn from other people's mistakes than your own. What other examination do I need to do to detect a stroke? Firstly, a stroke can only be seen in a neurological hospital environment if we're talking about neuroimaging, that is MRI, Connecticut scans. And many people have told me that they've taken their father, mother, or grandparents to the hospital, did a CT scan, and it seems like no stroke was detected. Is it due to bad doctors? No, there is a special MRT approach in DVI mode. In English letters, all angioneurologists dealing with strokes are aware of it. And this method allows to identify a stroke within the first hours of its development. This is an extremely important and informative method. It's obviously a specialist domain. But I would advise any middle-aged person once every 6 months, please check your neck and brain vessels, that is, get a vascular ultrasound to determine the degree of stenosis, how narrow your vessels are, because if the narrowing is more than 70%, that's a reason to consult a doctor. Not just to a neurologist, but to a vascular surgeon who will decide whether you should have an operation to remove this stenosis or not. But if the vessels are weak, naturally you want to strengthen them. Are there ways to do this? Well, let me be clear. These so-called vascular drugs actually don't play a significant role in stroke prevention. And that's not talking about anticoagulants and antiplatelet agents, which are prescribed by doctors, by cardiologists, neurologists, and general practitioners to prevent blood clotting and thrombosis. We do prescribe them, but they're not vessel strengthening agents. They help, and it bears repeating, to prevent, to aid in avoiding thrombosis and blood clots in the circulatory system. Now, improving the vascular wall with Hawthorne, vascularly active drugs, that's generally speaking, frankly, nonsense. And nootropics, which many in hospitals are very fond of prescribing to our patients after strokes. This is a big question. Do we need to do this? Again, I'm talking about nootropics that stimulate the nervous system. We have a separate video on this topic on YouTube channel. Watch it, look for it, please. Neuroprotective drugs, we've talked about them a lot too, by the way. They help the brain fight this or that problem. They feed your brain, unlike nootropics. Here's an interesting question. Do sleep disturbance or regular sleep deprivation affect the development of stroke? We talk about sleep a lot on the YouTube channel too. There's a big lecture on this topic. If suddenly your loved one or you in the middle of the night snores, there is sleep apnea. And this is associated with high blood pressure, with weight gain, then this is a reason to sound the alarm, ring the bells, and contact a sleep specialist or an experienced neurologist to be examined for obstructive sleep apnea. This type of sleep disorder leads to very serious consequences several times over. I am very sensitive to changes in atmospheric pressure. Can such a reaction of blood vessels be a risk of stroke? Well, in general, menthiotropy, the so-called magnetic storms, are very often reacted to by people of mature age. Those whose vascular reactivity is altered, the young will not notice at all. There is a blizzard outside, snow, rain, wind. That's the one who has vessels, as they say, just weak, who have poor vegetative regulation. And I want to emphasize once again that we also have a great analysis of the nervous system and autonomic regulation, a video. You are welcome to do it. Find and see, in this situation you react badly to changes in atmospheric pressure. But in fact, this is not a risk of developing a stroke. It is a reason to be puzzled, but not stenosis. I'm done. I have good blood pressure and I need to consult a doctor, of course, and why stroke can occur in a young person. A friend of mine died of a stroke at the age of 25, and this is indeed a fact, unfortunately. A person might not have high blood pressure, they might not smoke, abuse alcohol or drugs, they might not be overweight or have diabetes, which I just listed as very critical risk factors for a stroke. Yet, they can still have a stroke, this is true. If a person has inherently weak vascular system, they don't know that they have a vessel problem in their head. There is a so-called vascular malfunction. In simple words, their vessels, the walls of these vessels are in such a state that any exertion, heavy physical exertion, could lead to the wall rupturing, and they could die due to the covering of the leak. Another option is a so-called arteriovenous malformation, which they don't suspect, or they just have a headache periodically, and they continue doing heavy physical work. A stroke can also occur. If we take the clinical example of this guy who's been a stroke patient for 25 years, who seemingly doesn't have any harmful factors, then there could be a situation associated with heavy physical strain, overload, I would even say, when an individual, without measuring his abilities, begins to lift a very heavy weight, for instance, runs a marathon, metaphorically speaking, unprepared, something else, or works very hard and ignores certain factors, warning signs, which later turn out to be fatal to him. Let's say he starts getting headaches more often. His blood pressure increases, then it decreases, he forgets about it, goes to the gym, lifts weights, bang, he has a stroke. Everyone says, a healthy guy, and stroke can occur in a person who exercises. But of course, if you, so to speak, neglect physical activity, then it is a straight road to increasing stroke risks.